Here are 4 reasons why your physical therapy may not be helping your low back pain. Here we go. Number one is if your physical therapy program is emphasizing passive treatments, treatments where you sit down or lay down and someone else does the treatment for you. Ultrasound, electrical stimulation, spinal manipulations, massage. There's nothing wrong with these things, but they are not a long term fix. They provide short term relief. So, you want a physical therapy program that emphasizes your active role in your recovery, strengthening, mobility training, changing the way you move. That's the key. Number two is if your physical therapy is not teaching you activity modification. With physical therapy, you should be learning to identify your pain triggers, learning to identify which movements aggravate your symptoms, and then making modifications to how you move to minimize those pain triggers. That's more important than any exercise or passive treatment. So if you're not learning those pain triggers and activity modification techniques before your exercise program, then you're it's an uphill battle. Number three is not learning how to control your spine before you implement a strength and mobility program. Learning to contract your glutes, learning to brace your abdominals, learning to rotate from the hips, and learning to maintain a neutral lumbar spine during movements. This is crucial to your recovery. So, if physical therapy hasn't taught you how to do that before implementing, your exercise program, then you may be doing exercises that hurt you if you can't control your spine. So that's a huge step. That kind of goes along with number two. And number four is inappropriate exercises for whatever your spinal condition is. For over a decade now, I've heard stories about patients who go to physical therapy and they're prescribed exercises that are absolutely contraindicated for their condition. This week, I spoke to someone with severe spinal stenosis, and her physical therapist had her sitting almost in a sit up position and then rotating with holding a weight, and the patient told the therapist that it was hurting her, and she was told to keep doing the exercise. So um, it's physical therapy should not hurt. It should not hurt. There are cases where physical therapy does require some pain, such as a total knee replacement. Rehab for a total knee replacement is just painful, unfortunately. If you have something like a disc herniation, spinal stenosis, degenerative disc disease, scoliosis, any of these conditions, your physical therapy should not hurt. You're going there because you hurt already. So, inappropriate exercise selection is number four. And I hope this list was helpful for you today. It's just 4 things to be on the lookout for. If these have not been addressed with physical therapy, then I would say you have not received the proper physical therapy for your low back condition. I appreciate you watching today. I hope it was helpful. One thing to keep in mind is that different physical therapists are good at different things. So, perfect example, I would not recommend someone come to me for wound care, and I would not recommend someone come to me for hand therapy. That's not my strength. I know it's not my strength, so I owe it to the patient to let them know that this is not my specialty. Same thing with the spine. There's going to be some therapists that are really, really good at managing your spinal conditions and some that are not so good. So that's just something to keep in mind. And please subscribe if you enjoy this channel. And I'll see you next time.